limits your activity, you are not alone. It is the second biggest reason why people visit their doctor. And now a new study points to an alternative treatment for relief. CNN's medical correspondent Christy Fieg has details on that. Christy, there is not a lot you can do when your back is out.
That's right. It affects everything. And today we're talking about acupuncture, and that's the ancient Chinese practice of inserting very fine needles in points on your body. And it's growing in popularity in the U.S. Already, more than 8 million Americans have tried it.
When Dr. Michael Phillips incorrectly lifted weights while exercising in February, he hurt his back and it jeopardized his job.
As a surgeon, I have to be able to stand at the operating table, and for the first few days, I couldn't stand long enough to complete a 15-20-minute procedure.
The pain from several disc problems was so severe, Karen Morrison had closed her business, and even surgery didn't relieve the pain.
Walking, sitting, all of those activities that we take for granted, I could no longer do.
Both added acupuncture to their therapies. Now Phillips is operating for hours again, and Morrison is walking. That's not a surprise, according to researchers at the University of Maryland. They reviewed more than 22 acupuncture studies for chronic low back pain and found the pain level of patients who got acupuncture dropped 25%.
It is very effective, has been proven to be very effective in treating pain.
Acupuncture has been used in Chinese medicine for more than 2,000 years. Practitioners insert needles that are about the width of a human hair into specific points throughout the body.
The acupuncture needles stimulate the nervous system to release various chemicals, hormones, and neurotransmitters, which may result in a reduction of a patient's level of pain.
Now, other studies have shown similar results. In fact, the National Institutes of Health says that acupuncture is promising for reducing pain, inflammation, and even nausea. Kathleen?
So, Christy, do we need to be picky about our acupuncturist, or can we just go to anybody?
Well, personal preferences aside, there's a couple of things you want to look for. One is you want somebody who's licensed by the state, and most states do license their professional acupuncturists, and this simply means that they've gone through the rigorous training. The second thing you want to look for is that they use sterile needles. Now, this isn't as much of a problem as it used to be, but you still want to see the acupuncturist open the needles in front of you. Then you know they haven't been used on anybody else.
You know, it sounds like it works for just about anything. Is there anything that acupuncture doesn't work for?
Well, there's a couple of things that the jury is still out on. Things like blood pressure and asthma, for example. And, of course, it should never be used by itself for treating something like cancer. But do keep in mind, as we just mentioned, that it is an excellent treatment for the nausea associated with chemotherapy that patients go through.
Good to hear. Christy Fieg, thanks so much.